All right. I have no financial conflicts of interest to disclose today. So, when I was putting together this presentation, I was reflecting on the many return to use stories that I feel like we can all think of that don't have happy endings. And part of my research so far in graduate school has sort of spoken to this. So I kind of wanted to put a little disclaimer that this story does actually happen to have a happy ending. So I hope that keeps us all a little bit positive today. But so for the client I'm going to be talking about today, when I started seeing him, his goal was to get his bedding under control before he got married in August. So this is sort of like our goalpost that I want to orient us all to today, because it will sort of be a thread throughout the presentation. His other goal was a moderation goal, so he wanted to continue gambling in some sort of form, but he really did lack all confidence in being able to limit himself, quote his words. So these are sort of our goalposts for today. I started seeing him in March of 2024, and I do still see this client just on a monthly basis. A little bit of background on him. This comes from the first time I met him. So he is a 27-year-old cisgender white male. He was engaged at the time, but like I had said, he was getting married in August. No children. He was living with his in-laws most of the time when I initially met him. He had a full-time job in accounting. He lives in the Middle Tennessee area. He grew up with mom, dad, and brother, and it's particularly relevant that throughout our time together, he kept bringing up how overachieving his brother has always been, and just how much he has accomplished throughout his life. He has graduated college. He does have a history of therapy and had previous diagnoses of both OCD and generalized anxiety since childhood. He did note that the OCD was more present during his childhood and sort of has since fallen off as he's gotten older. Has been on Prozac and no current substance use at the time. He did endorse passive suicidal ideation when we first met, but that had sort of fallen off throughout our time together. His grandfather has a history of problematic gambling, and he really did have a limited social circle of friends, and he reported that nobody in his immediate social support system or circle knew that he had been struggling with gambling. So more about his gambling at intake. He started betting on sports just that he liked, so mostly football and basketball, in 2021. Then about a year later, he reported that he noticed himself chasing wins much more often and was feeling pretty bored at work. And this led to him spending more time gambling. He said that his betting amount has sort of always stayed the same, but the amount of time in particular that he had spent gambling had increased. And so during our intake, he was reporting that he was basically placing bets all around the clock. So to give a little more context around that, he said that he would bet on sports that were happening in another part of the world right before he went to bed, mostly tennis. And this was at 9 or 10 o'clock. And then as soon as he woke up in the morning, he would log on to the sports books to see what happened with his bets that he had placed right before he went to sleep. And that was happening pretty much every day. At the time of intake, his primary reason for sports betting was because it was fun and entertaining, and his main triggers were chasing wins and losses. He was noticing, and what was really bothering him was that his anxiety and irritability would increase when he had a bet placed, and he was really nervous about the outcome. And then anytime that he was experiencing financial distress, that would really make the gambling worse, and the gambling itself was also increasing financial distress. So then we start with the treatment. We had a lot of discussions around how he never thought he would have an addiction. He would always like talk about how like thinking about people that he's like seen on TV or that he knew in the past that like he saw as like having an addiction, and he was like, I would never be that kind of person. Like he was like, I never thought I would be that kind of person, or like very much like othering himself from this idea of like what addiction looks like. And I think this was really leading to like what was making him feel like he had to keep a lot of what was happening to him secret. And so that continued for a while in treatment. He really did not want to tell anybody about what was going on. He reported several like cognitive distortions around related to the gambling. So feeling like since the consequences couldn't get any worse, he just felt like why not keep trying to recoup his losses through gambling if like by continuing to gamble that would be the only way that things could get better, and like it couldn't make anything any worse. A lot of like ideas around like I've won before, so I'll win again, or if I don't place this bet, I could miss the win. And these like stayed intact for a long time. And then like as we sort of dove even deeper, it felt like he was having a lot of trouble sort of like replacing the gambling with other sorts of options, because he felt like gambling was this way to like stay productive. Like, I need to make my financial situation better. I don't want my fiance to find out. Like, my goal is to make this better by our wedding so that like I can come into this marriage in a place of stability. Like, I need to be doing something productive. And even when I think I had floated the idea of like doing online surveys as a way to like feel productive in short amounts of time. And like, he was like, even that is just like not productive enough. I need to be doing more. And like, it felt like sort of related like back to the brother, that this was a big deal for him. Like, he really wanted to be productive with his time. So yes, and then as treatment continued, sort of more and new triggers came to light. Talking about finances and life events with friends and his fiance were big triggers for gambling. And in addition, the boredom sort of like stayed intact. But there's a picture of a house on this slide, because I remember in a specific session, he told me he went out to dinner with his fiance and like another friend of theirs, like a couple friends, and the other friends were talking about how they were going to buy their first house soon. And he was like, I immediately opened my sports book and started placing bets, because like that anxiety and financial distress was like setting in so much that like he was like, the only way I think I could ever meet this goal and keep up with my friends and my life is by gambling and getting back all this money I've lost. So then we sort of reached this point in May, so I guess just a couple months later, where he is floating the idea in his mind of like reaching out for support. So he decides to tell his mom about like the financial distress that he's been in and the money that he needs to like pay back from some of his debts that are like causing a lot of distress. So after he tells his mom, he didn't gamble for a week after this, but then he opened back up the sports books, like due to FOMO of a playoff season that I'm not remembering right now, but maybe May is a sort of good point for that. But so this was his sort of like first like return to use. And he did say like he reflected on the pros and cons of what this like 1 week of not gambling was like for him. So the pros and cons of him sharing. And so he felt like this support emotionally and financially from his mom was like a huge pro of sharing. But big cons for him were that he felt like he had lost a lot of like independence, and felt like now that he had told his mom and returned to gambling, he was like, now that she knows I'm betraying her by like returning to gambling. And then he did report like some pros of like what this period of not gambling was like. He did say like that anxiety and irritability that he had reported before, like had sort of fallen off. He felt like much more relieved, not feeling like every day like his money was at stake. And we came back to that idea a lot. But from this experience, he did report like feeling a lot less confident in being able to meet an abstinence goal, since like he was like, oh, I had returned to use only after 1 week. Like, I suck at this, basically. So we have like this exercise in the gambling clinic called persisting through setbacks. So like, what happened? Like, we talk about this at the very beginning. Like, we talk a lot to our clients about how like returning to use is a learning experience, and like now this has resulted in him feeling like much more like self-deprecation. Like, how do I, like, I think I had felt lost and like kind of how to turn this around. So, but then I was like, maybe just this, like the comorbid anxiety for this client is really showing up here. Like the shame and guilt are just so intense, and this like stress and like need to be productive is like really coming to light here. Like, what do I do? So treatment continues. He acknowledges that he needs to engage in activities that feel meaningful to him and build community. But quote him, he uses this word like, or term, analysis paralysis. Like, he's like, I have so many options. There's so much I could do. I want to build community, but I don't know how. Like, and he just felt like stuck. So we're getting to like the pre-wedding time. This was like a big goalpost for him. So I want to make sure we do like a lot of planning around like what this period of abstinence is going to be like, because he has decided that he wants to be abstinent from gambling for 2 weeks before the wedding. So we shift our focus to this. We come up with like a bunch of strategies to use to help him like get through this period. So we land on having this mindset of like, I'm willing to accept defeat to complete my greater goal. And for some reason, this like really resonates with him, that he's like, okay, if I just accept like what has happened, I'm going to strive to like not engage in gambling as a way to recoup my losses. Like, I can complete my greater goal of being abstinent around my wedding time and going into this marriage like feeling stable. He reaches out to the certified peer recovery specialist through the gambling clinic like quite a lot through this time, and acknowledges that this will be a good strategy. He has a list of like different distractions he can engage in. He decides he wants to mute his social media around wedding time so that he doesn't see any ads for DraftKings or sports books, or seeing different like X, Twitter profiles that like talk about gambling. We talk about urge surfing and setting timers to like work through urges. We talk about cognitive restructuring, and he knows how to use like the cool off period on different apps to maybe like use those during this time. And he feels super motivated. So I'm like, all right, we're ready for this. We're like well prepared. So wedding time, this is what he reports. So we don't meet for a while, like through the wedding period. So this all comes up like after our first meeting after the wedding, which I think is at the beginning of September. He reports that he did not place any bets from August 1st to August 8th, but he did end up reopening the sports book on his honeymoon pretty infrequently. But he said this happened during times where he was feeling like bored. So like they were like in the hotel room, not really had a lot planned that day or something, or like it was a rest time and his wife was like resting and he opened the sports book. And I think what was contributing in addition to the boredom was that, again, he was like feeling this FOMO from the football season, like wanting to place bets on that. So he comes back from all this, and yes, during this first meeting, we end up making another moderation goal for for the rest of our time. So now the long haul. So he, shortly after this, around like the September, October time, he reports wanting to end treatment because he feels increased confidence in managing betting, and feeling less like that urge to chase. So, quote him, "I'm okay with managing this condition rather than being fixed." So we decided to move into the follow-up period. He has a desire to lean on his wife more for support and wants to find a new therapist for problems like not related to gambling. So we had just decided to move into the follow-up period, but when we were going to do our 1 month follow-up, he ghosted me. So I asked to follow up and everything, reschedule our 1 month follow-up we had planned, totally did not talk to me. So I suspected a return to use time and not really keeping up with the moderation goal we had set in place. So then February rolls around and he requests to have a session with me through the certified peer recovery specialist. And he shares with me that he has not placed a bet from February 8th to February 24th. He shares with me that he has shared everything with his wife, everything that's been going on. He has decided to go to GA meetings and he got a sponsor. And at the time that he shared this with me, he had been going to GA meetings, I think twice a week, and was really sticking with it. And all this, he is not in Tennessee anymore at this time, so he actually has GA meetings to go to in person that are very close to his house, and he's been enjoying that a lot. What he came to me with most was that he had been grappling a lot with anxiety around past mistakes, particularly related to the gambling, so we sort of have addressed that. So at this point, he has been 60 days with no gambling, which this is the, ending of our happy return to use story. The tornado in this picture is because recently we have been using the tornado as sort of a metaphor. So when he came back, he had told me that he took the LSAT and applied to law school, and he was and I just did not do that well on the LSAT, and I feel my application to law school was terrible. And in my mind, all I could do was relate this to his intense need for productivity and success. And I was in the background, there has been this huge tornado coming through your life, and you have gotten through this tornado and have stayed standing, and that's a huge accomplishment. But you feel really stuck in who to share this success with, and you want nobody to know about this tornado that has blown through your life. And so we keep coming back to this metaphor of the tornado, and that it's okay to potentially share and see that as a success, what he's been doing in treatment, and feel really proud and productive in that, and that the law school stuff will come when it's supposed to come. Okay, so my takeaways. Social support feels like a huge thing when it comes to managing return to use. And I think through this client, we have seen how important that is, that at each step when he has been able to share just a little bit and reach out a little bit more and more for social support, that's when he has been the most successful in remaining abstinent. Then I feel at each point in this too, the need for things to remain secret, and a fear of sharing or not knowing who to share with, and this I guess feeling reserved about being honest, has made it more difficult to remain abstinent. And I'm sure we can think of so many clients that we have where this comes up. And I find it to be one of the hardest things, I think, to talk about in the clinical space, because I think sometimes we can feel really like powerless when I hear stories like this. I think for this client in particular, the comorbidities were a big part of the return to use. I refer to them as like flares because I didn't actually like know what other word to use, but when the cognitive distortions felt like so stuck for this client, like when all of the strategies we had talked about or any sort of like cognitive restructuring just was like not cutting it, that's when his like gambling became worse, or when he like, I think when the urges were intensified, which like made the return to use like more likely. Again, sort of like that productivity thing. And then this identity shift idea mixed with like, I guess I called it like existential life events. And I, as someone in my like early 30s, I don't know, with this client and I being sort of similar in age, it feels like the big life events thing was sort of prevalent too, that like when he was able to like sort of, I guess, like accept that he was having a problem gambling and like lean into this idea in some ways, he was able to like get so much more support, and I think like manage urges and deal with return to use in a much more like effective way. And so like I say here, like when this idea of like I have a gambling problem, like get that, like being able to get him to GA meetings, I think was a big part of this. And then this like idea of wanting to accomplish the same things his peers are, like I think perpetuated the gambling more, like, you know, this productivity thing I keep coming back to for this client in particular, like that when he could like sort of take a step back and in some ways, I guess, accept that meeting these goals may take him a little bit longer because of this tornado that has blown through his life, like he can feel like less stress and that it will like come in time. So I guess this is my last slide, and maybe some like potential point of conversation, but for all of my clients, I think return to use as a provider really takes a toll on me. And I don't know if maybe we could speak to that in this space a little bit too. Like, I'm really curious about how other people manage that, because I think often, even if you come up with what you think is like a bulletproof plan, like it may not always be the bulletproof plan you imagine. So yeah, that's all I got.
Great. Thank you so much, Rachelle. We'll start off with clarifying questions if anyone wants to ask anything about this case that would help them better understand it, or things they're additionally curious about.
I'm curious, just financial wise, how much debt he had accumulated.
That is a great question. And I will say, actually, with this client, I think I purposefully never asked this question. I think because of like the intense like shame and guilt that I could feel in every session, I was like, I wanted to be really purposeful in asking that I almost felt like if I had ever asked this question, this client would have like crumbled to the ground and would have never been able to like show his face to me again, like in session. So I know that's like a normal part of our protocol, but I will be totally honest, I did never ask this client this question, probably purposefully.
The reason I ask that is, my work has been primarily with substance addictions, but I recall somebody from 1988 whose diagnosis was alcohol use disorder who also had a gambling addiction. And this man had lost his business. He was $70,000 in debt, which is close to $200,000 today. And in spite of that, would return to use with the idea that this was the time he was going to win it all back. And that belief to me just sounded almost frankly delusional.
that was certainly present with this client. I guess to give some more context around that, he told me at one point he was placing $200 bets and sometimes up to 15 times a day. And this was every day. So it was probably significant debt that he was in.
But would that really make a difference if he's losing or winning? Like, say, for example, if the issue is I'm doing this thing and it's making me anxious and it's taking over my life, um, even if he's winning, he's still, he still has facing the issues with addiction. You know what I'm saying? And that makes it even worse. It's like, okay, now I'm trapped even more, you know.
Well, I think that I was wondering if he even considered to share this problem before he got married with the fiance. Has he ever, really talk about sharing it before marriage? Or he was thinking if he would share, the marriage would go south?
I think he was worried about that. He did not think about sharing it before. Yeah, that's right.
And one thing that is different from the gambling addiction and the substance use addiction that they have, usually people that they are using those substances that tolerance build as a result of the effect of the substance, they usually using later on to not having a withdrawal. They don't really get as much high that they supposed to. But gambling, each time there is a hope of the winning comes on board, and that excitement of the before the release of that I lost again, they have that excitement coming, and that is a difficult part. That's why they multiple times they go and they invest the money on that one. So it's a very good case to discuss. Yes.
I also think it's hard nowadays because like with sports, like you can just do everything online, right? So it's easy, accessible. Also from societal point, it's accepted, right? Like we still root for lottery and this thing. So I think it's something that it is hard to tackle. That's what I'm trying to say.
Yes, this might be a tangent, but this client and I were sort of now using some humor around that he was walking down the chip aisle and even a chip bag was advertising the DraftKings app. And he was like, I can't even buy this bag of chips. And yeah, it's everywhere. And it's, yeah, really awful.
Does anybody remember a movie called Owning Mahoney that I saw back, I remember in the 90s, and it was about gambling. It was about a gambler. And I was trying to remember Philip Seymour Hoffman, I think, he played Mahoney, who actually he overdosed and died. But the movie was very striking in the way it ended when they asked him how it was when he was gambling these multi-millions of dollars, which he didn't have. And he was like, it was like the best. And it was very stark, of course, about the pull of this type of gambling and how everything else in your life is so below that. It was like, I remember seeing that and going, uh-oh, holy cow. you know.
I was just curious about a couple of things you might not know, but do you know if he decided to share with his wife after discussing with his sponsor, or after like encouragement from his mother, or if he like couldn't explain where he was when he was going to the Gamblers Anonymous meetings, or how that, maybe came about? And I guess a follow-up question would be if he had have wanted to do like a couple session with his wife or his mother or brother or whoever, like a family session. Is that something that that y'all provide too?
Dr. Gilling, you might know the answer to the second question better. I don't know, like, I can disclose that, right? Like, okay. I don't know the answer to your first question. I don't remember what had prompted him sharing. But the second question, when he had told me he did share, I had told him that his wife could call the gambling clinic because we have the option for treatment for loved ones also. So she has come to a few meetings, and I know sometimes the idea of doing some sort of family or couples thing has been floated. I don't know if this client will or has done that. I think we try not to talk when the partner is in doing stuff too.
I have a question. So for substance use, we learned that usually patients, when they are in remission, they start thinking about using 2 weeks, at least 2 weeks before the relapse. Does it happen with gambling also?
I'm not sure how to answer that one.
Mm-hmm.
Yeah, I don't think we have that data. Yeah, I don't think that data exists.
Okay, and if that happens, for example, for substance use, they have change in behavior. We see that they stop coming to the counseling meetings and stop coming to the clinics. What do you do to reach out to the patients in that case?
For the gambling clinic specifically,
Yep.
I think if I'm understanding your question right, the peers are like a big part of that process. And this client happened to have like a good relationship with his peer. And so his peer, I think, even kept in touch with him when I found out his peer was keeping in touch with him even when I wasn't seeing him in the clinic. So the peer, I think, did a great job continuing to reach out to this client during this time. And then I feel like, in addition to that, I almost feel like it's therapist preference, like how much they reach out to a person after they don't come. I know I err on the side of many an email and phone calls, but I think that might just be my style. But I'm sure everybody here kind of does their thing. I don't think the gambling clinic has. We sort of have a specific protocol, but yeah.
Okay, thank you.
Well, you raised the question about how we manage the return to, gambling again, and I think that would be a good idea to talk about it. See, when we have a substance use problem, and we provide some medication, and we have a frequent, encounter with the patient, and we also ask them to cut their, relationship with their drug dealers, for example, don't have their name on a phone and all those stuff. We take steps like that. For the gambling, because it's an individual, action, they need to limit their resources. Like they're using the credit card, for example, to bet and they will give the control of that credit card to their wife, for example, or the husband. It depends, which one is doing the gambling. So there are lots of those things. I would wonder that if that came to the discussion, that who is going to monitor or have some kind of supervision on this case.
Rachelle, I actually have a question because the way you posed it, and I may have misinterpreted the intention with the way you posed it, so correct me if I'm wrong. But just the idea of like when you have a client who returns to use, it takes a toll on you, that just that feeling of like this is not going how I thought it would go. In what way does that, how does that manifest for you? Like, what does that feel like? I might be asking something way too personal, but just like, what is that like? What is the experience like for you when you have someone who has a return to use?
I think for me, it feels like I failed them. Like I'm the one that's supposed to know the like structure of a bulletproof plan to prevent like return to use, and I have failed this person because I didn't have the knowledge or and I think that sets in more as a student too. Like if I had more training, I would have done this better, and this client would not have been in this situation or something like that. So yes, I'm definitely open to us having a conversation about how to manage that to just be better.
You
I was
know,
going to share with you. Oh, go ahead, Jack. Sorry.
I was just going to say, with alcoholism, there's a companion group, Al-Anon, that's targeted to people who care about folks with the disease. And the interesting thing that I learned about Al-Anon is that the first step in Al-Anon is the same as the first step in AA. Admitted we were powerless over alcohol. So that one of the approaches that Al-Anon takes is in the same way that the person with the substance use disorder is powerless over alcohol, the person that cares about them is also powerless over the disease.
And I was just gonna add to some of this is my previous experience, like before I got into addiction. I used to deliver babies. I was family medicine and I did full scope. And deliveries were sometimes really long and difficult, and it felt like you're like you're going back and forth. Is this gonna how is this gonna come out, right? And then things would happen during the delivery that the delivering person was just kind of like, this is miserable. I hate this. When is this over? Help me out. Just get this kid out of me, right? Like it's a horrible, terrible experience that they want it to be over as quickly as possible. In some ways, kind of like, I don't want this happening to me anymore. I don't want to be held captive by the laboring process. I don't want to be held captive by my addiction, by my substance use disorder, by whatever it is. And things happen you don't want to have happen. One of my favorite points in a delivery, this is going to sound wrong, but one of my favorite points in a delivery is she's laboring and she gets sick to her stomach. She starts vomiting. And I'm like, yes, that's weird, right? Maybe it's just me. But when that happens, what's going on is her body is starting to experience some really fast physiologic changes. And I know we're getting close. The other thing it does is but that retching pushes the baby down in the pelvis and really gets great application of the head against the cervix. That cervix is going to go. I'm like, we are almost to the finish line. So this ugly thing she has to experience means we are close to our achieved goal. The thing we want to get done, we are close. And I think about return to use as the same kind of thing. Return to use is like, I know you're really upset about that happening. I know you did not want to have that happen. But truthfully, there's some amazing stuff we can learn from this return to use episode. And I get excited about the learning process. And so patients coming and they're just like, the shame and the grief and all that kind of stuff. And I'm sitting in my chair, like I'm hardly able to sit still. I'm like, oh, I'm so excited. Tell me more, tell me more. Because it's an opportunity to kind of dive into like, what was the path what happened? Like we had this great bulletproof plan and it came apart. What happened? So when you look at what happened, that means that you have knowledge, you can go together with another plan. So coming from that bizarre way my brain processes, maybe other people kind of experience it similarly. When I see my patients stumble, it's like, now we know that's an obstacle for you. Now we know that's a trigger we didn't know before. Now we know more than what we knew. And it means we're going to get further. I see the goal you set as actually being closer, even though you're seeing yourself as having failed. I see us moving closer to the goal because now we have new knowledge. So just like when my laboring patient starts puking, I'm like, wear the sterile gloves. Let's get this going, people. Because I know we're close. Something major just happened that made her feel terrible, but I know we're making progress. So I use that same filter when I think about a return to use.
And I also
Strange
remember,
analogy, but
yeah, also I remember always, thinking about it is, okay, I'm a GPS, but the person who is driving behind the wheel is the patient. So I'm just giving a direction sometimes, and they can turn me off. They can, turn me on again. And in a process, as you mentioned on this case, it was a period of time that he disappeared and then he came back. So that's the time that he turns off the GPS. So you can give the direction, you can give them the suggestion that, for example, how to manage their life, but he is the one that is sitting behind the wheel and driving. And I always tell my residents and fellows that if you are finding yourself that working harder on the case than the patient, you are in the wrong path. So
I think
Quite a bit.
I was just going to say, I recall several years ago reading an article about smoking cessation that said on average, people that successfully quit smoking make 4 to 5 serious quit attempts before they're successful. And we don't talk about that so much with other substances of abuse, but I think it's very similar. And I think a lot of times that first episode of return to use, what people learn is that it's not going to be easy. I think a lot of folks start with this disease kind of, well, I understand what the problem is now. All I've got to do is change the behavior. And then that first return to use, they begin to get a glimmer that this isn't going to be simple.
And I'm sorry, Jack, I didn't want to jump. I'm sorry for cutting you off.
No, I cut you off. I'm
No,
sorry.
you did. I cut you off. But I did want to say, one thing I tell the residents is that our profession leaves scars, and it does leave scars. It leaves scars places that you don't really know you're vulnerable. And that the passion to do what we can do to help people that makes you a good provider and a good physician or whatever, it's a two-edged sword, isn't it? Because uh, wanting to help people, but we can't do it for them. But we have the capacity to change people's lives, but we can't do it. They have to do it. And it does leave scars. You get involved in these patients, and that's what makes you a good provider. And then, but with that is it's important to do self-care, which sounds funny for me saying as a non-mental health professional, but it is. It's so important. Um, but it's so important for us to do self-care because we give so much and we work so hard. We do, and it's important for us. It is. I'll be quiet.
And the important thing is we don't give up. So have you ever tried this, direction, and then you pass the exit and they said recalculating? So we are recalculating anytime that they come back to us. And that's the things that we need to keep in mind because that's their life. They make the decision. So just remember that.
I love the analogy, Cameron, a lot. You know how much I love analogies, so thank you. That one's going in my back pocket.
Also, I know you had asked the question about like how to manage return to use, and this is I'm sure Dr. Gilly can speak to this a lot more, but I think in relation to this client and others in particular, like I guess specifically when we get to like the follow-up period, like when the treatment is kind of over, like what we do for the like relapse prevention space is like, I know that depending on their goal, like I give a lot of information around like self-exclusion or like cool off periods. I think like I talked about, like if that's something they ever become like interested in, if they're not already doing it, like that's some of what I do. And then so which I did like with this client, but then if their goal is like moderation, like with this client, I think I don't know, I frame it also sort of like in a harm reduction way of like how can you continue to do this in a way you feel comfortable and confident. And I think we like have a goal sheet that we go over that sort of sets stipulations, and I think doing like a plan like that is where I have found some success. So if that answers your question, that's what I do mostly for gambling.
I recall several years ago reading an article that people with recovering from alcohol use disorder, 30 to 40% of them at some point develop problems with gambling. And which has kept me personally away from casinos. But I wonder, is the reverse true? Those of you that work with gambling disorder, do you find folks achieving some kind of recovery from their gambling problem, but then going on to develop substance use disorder?
This is there's not a ton of research in this area, and it's like two main studies, and one finds the opposite actually is that the skills related to the gambling behavior modification translate well to any high-risk behavior you would like to modify. And then the other study, which is it's a smaller sample and it's not the the treatment for the gambling is not as robust, but finds that it is like because there's that other things that were maybe lower level but present increase as the gambling comes back. But I guess the confound in that study is that they just don't teach coping skills as comprehensively. So I think if that's one of the overall mechanisms of change is like being able to better approach and change whatever it is in your life. If you get that from the gambling treatment, it seems to work for everything. If you don't get that from the gambling treatment, then taking away the gambling as coping means that they got to find something else to cope with. And it might be alcohol. So, in general, with our treatment, we find pretty conclusively that even if people are not targeting a comorbid use disorder, they decrease rapidly over the course of treatment. But some of it is because of generalizations of skills, and some of it is just like removing themselves from those environments. Like if you don't need to stay up all night at the casino, you don't have to do meth anymore. Like it's like just pragmatic sometimes. But a lot of it is it's like I have other like I now go for walks when I'm stressed. I don't drink or gamble. Mhm.
Also, with several clients, I don't know if there's any literature around this, but like by session like 5 or 6, they're asking me like what constitutes an addiction. They're like, am I addicted to food? Am I addicted to video games? Am I like they're like, if I have this addiction to gambling and this is everything you're telling me, like what else am I addicted to? And so I talk through that too, but thank you guys for sharing your experiences also.
Any other questions or general comments about managing return to use, managing ourselves as providers during return to use? Yeah, okay.
I was just going to say this online sports betting must be really changing the field for gambling addiction.
Yeah, it's at least 50% of our client population at this point, where it used to be prior to 2020. It was less than 10% probably were sports gambling primary. But yeah, we still the casino gambling is still really, really problematic, but particularly for this young male age group, which really doesn't present to treatment with very high rates for anything, that they're presenting with such high rates of this probably means that we're just at like the tip of the iceberg for what's that portion of population that's experiencing harms. So yeah,
Well, in
it's
general, online, like the shopping sprees, online, alcohol use. They order and they come in a gallon, box by box to their house, and they don't have even to go, and it's 24/7 available. So there are lots of things that online system is making it easier for the patient to get engaged, and that I wouldn't be surprised that there is an online source of the illegal substances that is delivered to their house without any problem. So yeah, that's a problem that the technology sometimes makes things easier, but also sometimes makes it more difficult. And that's how we have to improve our approach to.
Yeah, and I think a lot of we see they're like working from home because there's just like lack of other structure, lots of free time, lack of social support. So it's like, yeah, like all of these are because like online is so good that you can work from home. So it's very, the landscape is changing rapidly.
Do you know by chance, are there resources from the gambling industry or the state lotteries or whatever for treatment for gambling addiction? I see billboards sometimes when I'm driving, and
Yes.
but I didn't know. Yeah, go ahead.
So when the law was written in Tennessee to legalize sports wagering, there's a specific portion of it's 5% of gross revenues that gets designated for treatment and prevention that gets directly sent to the Tennessee Department of Mental Health and Substance Abuse Services. And then the sole vendor is the gambling clinic in the state of Tennessee, and we were responsible for providing statewide prevention and treatment services for all Tennesseans at whether or not people can afford it, we provide it. So we're trying to make that increasingly accessible and as evidence-based as possible. We're trying to do research on absolutely everything we're doing. Tennessee is actually I guess I would argue, I think many would argue that Tennessee is the national leader in this effort of making sure that the known harms that will come by increasing access are going to be met with comprehensive care.
It's really awesome, Meredith. It's just fantastic, amazing. Makes me so glad I know you. Thank you.
I think this case was a good, at least end of the session for us. It was a good discussion. I enjoyed it. Thank you so much.
I'm so glad.
Agreed. Thank you. It was a good one and different than what we've had with all the others. So gambling is incredibly important to talk about because we see it coming up with our patients as we quiet one substance use disorder. This one will come up. If it's not a different substance, it will be gambling. So this is important, good work. So thank you, Rachelle, and thank you, Meredith.
Good plug. Do you want to plug next year, Joyce?
Right. Really simple. We'll be doing this again. We take a break for the summer, even though it's just barely spring. We're already planning our summer break. So it's September-ish when we'll be back. So we'll be paying attention to your inboxes for information about the upcoming series and getting signed up for it. The evaluations that Melissa talked about at the very beginning, super important you guys do that because that's how we plan this year. Really, really would be fantastic if you could even leave some comments about the structure of the way we did it this year, because this was very different than the way we've done it previously. Personally, I really liked it, but not to bias your answers. Tell us what you thought about this approach. If it was something that you enjoyed, you liked it a little bit more of the traditional echo like we had done before, where it's didactic and case presentation in the same session. This year we did it where it was a lengthier didactic, more in-depth, followed up with a case presentation. So we essentially had 3 topics with cases to match them. So that's what we did this year. If you loved it, hated it, were indifferent to it, let us know what you think, as well as topic ideas that you would like to hear more about or something new you want to know more about. Just put that in your evaluation and we will take that into account when we're doing our planning. Did you want to add anything, Melissa?
No, I was just gonna say just that evaluation is very critical, but yes.
Or we'll just make it up. I don't know. We'll show up and do puppet shows or something. So let us know what you
Yes,
want.
the more you tell us, the better is that we don't have to make up. But thank you all again for your time. We look forward to seeing you next year.
Definitely. Bring friends. Always. Thank you, Suzanne, for bringing friends. Bring some more.
Bye.